If you're over 60, there's something incredibly personal you do every single night that could quietly be raising your risk of a stroke without any pain, without any warning while you sleep. Imagine this. You go to bed feeling completely fine, just like any other night. No chest pain, no slurred speech, no dizziness to alert you. You simply drift off feeling perfectly normal. But by morning, something has changed. You wake up confused, unable to speak clearly, or you can't lift your arm. A stroke, silent, sudden, and utterly life-altering. All because of something as simple as the way you sleep. As a brain doctor, I've seen this devastating scenario far too many times, and surprisingly, it's not always due to smoking, a poor diet, or lack of exercise. Often it stems from common sleeping habits that most seniors, perhaps even you, believe are safe. But trust me, they're not. Today I'm going to reveal 9 dangerous sleeping positions and nighttime routines that may be dramatically increasing your risk of stroke, brain bleeds, or sudden blood pressure spikes, especially during those quiet, vulnerable hours when your brain is most at risk. If you or someone you deeply care about is over 60, paying attention to this video could genuinely save a life, maybe even your own. So, please, don't look away. Let's begin this vital conversation now. First, let's talk about sleeping flat on your back with no pillow or with your head level. It might seem utterly harmless, perhaps even comforting. Many older adults have slept this way for decades, lying flat on their back, arms at their sides, without any pillow. Some believe it helps with back pain, others feel it opens up the chest. But here's the crucial detail almost no one tells you. Sleeping completely flat without elevating your head can silently increase your risk of stroke overnight, and you might never even feel it happening. When your head lies perfectly level with your heart, while it sounds natural, physiologically, it's actually detrimental, especially as we age. Our neck and brain vessels gradually lose their flexibility over time, meaning blood doesn't flow as efficiently. The veins responsible for draining blood from your brain must then fight against gravity. Instead of smooth drainage, blood can begin to pool, slow down, and even form clots, particularly in the early morning hours when blood pressure naturally rises. When these blood clots form during sleep, they rarely stay quiet for long. Just one small clot in a narrowed vessel can lead to devastating consequences: slurred speech, facial drooping, permanent disability, or even death. Consider the story of Mr. Leonard Whitaker, a vigorous 77-year-old retired mechanic from Michigan. Leonard was strong and independent, still fixing lawnmowers in his garage. Every night he slept flat in bed, no pillow, just the mattress, with his hands folded on his chest, a habit he'd carried since his Navy days, which he swore helped him sleep deeply. One morning his wife Mary found him half awake, but utterly unable to speak. His eyes were open, but one side of his face had fallen, and he couldn't lift his right arm. At the emergency room, a scan revealed a clot in his left middle cerebral artery, a type of ischemic stroke caused by blood thickening and clotting inside narrowed vessels, often during sleep. His carotid arteries were stiff, and blood had pooled for too long. His sleeping position was directly linked to this event. Doctors dissolved the clot quickly, but Leonard was never quite the same. His speech is slower now, and he uses a walker. Every night, Mary carefully props him up on a wedge pillow, wishing they had known about this simple adjustment years earlier. Many people don't realize that lying flat, especially with age-related vascular changes, compromises venous drainage from the brain. In simple terms, your brain's plumbing system slows down, and stagnant blood becomes a breeding ground for clots. Add natural overnight dehydration and low oxygen saturation, and you've created a perfect storm. This position is particularly risky for seniors with high blood pressure, atrial fibrillation, sleep apnea, a history of carotid artery disease, or those on blood pressure medications that might lower pressure too much at night. The safest adjustment is a slight head elevation, about 30 degrees. This helps gravity assist blood flow, reduces pressure inside your skull, and allows the brain to oxygenate more evenly. Even 1 or 2 supportive pillows can make a profound difference. Always choose a pillow that supports the natural curve of your neck, rather than one that pushes your chin forward. This isn't just about comfort. It's about optimizing blood flow to the most delicate organ in your body, protecting your independence, your memory, and your ability to speak, walk, and truly be yourself. Leonard once told me, with tears in his eyes, "Doc, If someone had just told me that sleeping flat could do this, I would have changed it years ago. Let me be that someone for you today. If you think sleeping flat on your back is concerning, wait until you learn what happens when you sleep face down or in the prone position, where your neck bends in just the wrong way, potentially cutting off the very arteries that feed your brain. There's a quiet mistake many older adults make every night, one that feels comforting, familiar, and seemingly harmless: sleeping on your stomach. Perhaps you started this habit to ease back pain, or maybe you enjoy the pressure on your chest or the sense of feeling cocooned and safe. However, I'm here to share something you may have never heard from your primary doctor. Sleeping face down can be one of the most dangerous positions for your brain. While younger bodies might tolerate it without much harm, as we age, our circulation slows, our arteries harden, and our oxygen levels dip more easily, especially during the crucial deep sleep stages. When you sleep face down, several dangerous things begin to happen. Your neck turns sharply to one side, allowing you to breathe, but this position compresses the vertebral arteries. These vital arteries carry oxygen-rich blood from your spine to the back of your brain, a region critical for controlling balance, coordination, and even your ability to stay conscious. Furthermore, this posture also puts pressure on the carotid arteries, particularly when your head sinks into a soft pillow or mattress. Blood flow slows, and the veins meant to carry blood away from the brain become kinked. Stagnant blood collects, thickens, and in vulnerable individuals forms blood clots. These clots may sit quietly for hours, awaiting the early morning surge in blood pressure, which can dislodge them and send them directly into the brain, resulting in a stroke, often massive and sometimes fatal. I'll never forget Mrs. Ethel Lawson, an 82-year-old retired school teacher from Ohio, who came to me after a terrifying experience. Her daughter found her one morning lying awkwardly on her stomach, her speech garbled, and her left side unresponsive. Ethel was rushed to the hospital, where a scan revealed a large ischemic stroke affecting her cerebellum, the brain part responsible for coordination and balance. The cause wasn't high cholesterol or atrial fibrillation. Ethel's carotid arteries had narrowed with age, and the hours she spent sleeping face down with her neck twisted had reduced blood flow just enough for a clot to form. By morning, the damage was done. Ethel survived, but she no longer drives and struggles to walk without a walker. She often tells me, "I had no idea something as simple as how I slept could nearly take my life." Scientifically, in the prone position, neck rotation can reduce vertebral artery flow by over 40%, especially if your pillow or mattress forces your head backward. Chest compression can also restrict lung expansion, leading to low oxygen saturation, which adds stress to your heart and brain. Obstructed airflow can increase carbon dioxide retention, further altering brain blood flow and often leading to vascular instability. As we age, our tolerance for oxygen drops isn't what it used to be, and our body's natural response time slows. A 30-year-old might wake up gasping and readjust, but at 70 or 80, the same drop in oxygen might go unnoticed, silently setting the stage for a nighttime stroke. If you snore, have sleep apnea, or take sedatives or sleep medications, sleeping face down is even more perilous. As your body is less responsive, your airway is more prone to collapse, and the risk of a silent, oxygen-starved stroke significantly increases. If you or a loved one sleeps on their stomach, I strongly urge you to try switching to your side with a firm pillow that keeps your head aligned. Or better yet, sleep slightly elevated on your left side to help protect both your brain and heart circulation. These small changes aren't just about comfort, they are about survival, because what feels cozy might be placing deadly pressure on the very arteries that keep your brain alive. Remember, it's not just about how you sleep, but also where pressure builds while you sleep. Next, let's discuss a sleeping habit millions of seniors unknowingly adopt, especially those with hip or shoulder pain, that quietly cuts off blood flow and leads to sudden strokes in the night. It often happens on your favorite side, when you sleep with your arm pinned under your pillow. Another deeply personal habit many seniors have carried into old age, something comforting, almost childlike, that we do without conscious thought, is pulling the blanket up over our heads at night. Maybe it's to block out noise from a snoring partner or a humming fan, or perhaps the room feels drafty or too bright. Or maybe, like many who grew up in colder homes, we find a unique peace under that warm, silent cocoon. However, for older adults, this small nighttime habit can quietly turn deadly. When you sleep with a heavy blanket over your head, you're not just blocking light or sound, you're significantly limiting airflow. Over the course of the night, oxygen levels drop inside that tiny space, while carbon dioxide, the waste gas we exhale, builds up around your nose and mouth. While your younger body may have tolerated this decades ago, at 60, 70, or 80, your brain doesn't recover in the same way. Low oxygen and high carbon dioxide during sleep increase your risk of blood thickening, and in vulnerable brains, this can lead to the formation of dangerous blood clots. Let me tell you about Mr. Richard Hale, an 81-year-old retired postmaster from Iowa, a quiet, thoughtful man who always loved the feeling of sleeping in the dark. He told me he'd been pulling the covers over his head since childhood. His wife used to gently tease him, saying he looked like a bundled-up caterpillar, but it made him feel safe, relaxed. So every evening, he tucked in tightly, pulling a thick quilt over his head and curling into sleep. Then one morning, Richard didn't get out of bed. His wife, alarmed, found him groggy and unresponsive, barely able to open his eyes. When the ambulance arrived, his blood oxygen levels were dangerously low. A hospital scan revealed he had suffered a silent stroke in the early morning hours. A clot had formed and lodged in a small vessel deep in his brain, not from atherosclerosis or atrial fibrillation, but from oxygen deprivation during sleep, compounded by age-related blood thickening. And yes, one of the significant risk factors was sleeping with restricted airflow under a heavy blanket. During deep sleep, especially REM cycles, your brain requires consistent oxygen flow. When you're under the covers, rebreathing stale air, your oxygen levels drop. Your heart compensates by beating faster, and your blood pressure begins to fluctuate. These sudden spikes and valleys place tremendous stress on already fragile vessels. Add in mild dehydration, slow circulation, and age-hardened arteries, and you've created a perfect setup for a clot to form. The terrifying part is you might never know it's happening. You go to sleep feeling warm and safe, but your brain is slowly suffocating, and by the time the damage is done, you may wake up a different person. If you wake up at all. Medical studies have clearly shown that even mild hypoxia, reduced oxygen levels, during sleep is linked to a significantly increased risk of stroke and cognitive decline in seniors. This isn't only a risk for those diagnosed with sleep apnea, it can affect anyone whose breathing is disrupted by their environment or posture. If you're someone who sleeps with a blanket over your head, even just during the colder months, it's time to seriously rethink this routine. Instead of pulling the covers up, try wearing a sleep mask to block out light or use earplugs for sound. Keep your room at a comfortable, warm temperature and invest in breathable, lightweight bedding. This isn't about sacrificing comfort. It's about protection, about giving your brain the essential oxygen it needs to restore, repair, and survive the night. Strokes don't just happen to other people. They happen to good people, thoughtful people, people like Richard, who had no idea that a lifelong habit could nearly steal his ability to walk, talk, and remember. He now sleeps with a wedge pillow, soft lighting, and his blanket folded below his shoulders. He quietly told me, "I never knew something that felt so safe could be so dangerous." And he's not alone, because what we don't know can truly hurt us, especially while we sleep. But as dangerous as a heavy blanket over the head may be, it's nothing compared to the next habit, one that millions of older Americans rely on for comfort, yet it might be silently cutting off blood flow to the brain: sleeping upright in a recliner. For many older adults, sleep becomes more challenging with age, not just falling asleep, but staying asleep without pain or discomfort. Achy joints, stiff spines, acid reflux, and shortness of breath all too often lead to one common solution: the recliner chair. You might know someone who has entirely abandoned their bed, or perhaps that someone is you. Night after night, recliner sleeping becomes routine. A soft blanket, the television humming faintly in the background, the chair angled just right, it feels secure. However, what feels safe can sometimes be quietly dangerous. As a brain doctor, I've observed how this position, sleeping upright in a reclined chair, can slowly, silently increase the risk of stroke overnight. You see, the human body was designed to rest flat, allowing blood and oxygen to flow evenly throughout. But when you sleep in a semi-upright position, perhaps at 45 to 60 degrees, you're putting your circulatory system at a significant disadvantage, particularly if you're older. In this position, gravity does two crucial things. It pulls blood downward, away from your brain, and it compresses the major veins in your legs and hips. The result is sluggish blood flow, pooling in your lower limbs, and a much higher risk of clot formation. In younger bodies, this isn't as dangerous, but after age 60, the situation dramatically changes. Your blood becomes thicker due to age-related dehydration. Your vessels grow narrower from decades of wear, and your heart pumps less efficiently. This slow-moving blood, pooling in your lower body, can form clots, small, sticky, silent threats that may travel upward during the night or early morning hours. All it takes is one of these clots lodging in a vessel in your brain, and the damage is done before you even wake up. Let me share the story of Mrs. Barbara Keene, a 79-year-old retired florist from Kentucky, a lovely woman with a sharp memory and a gentle smile. She began sleeping in her recliner 5 years ago after hip surgery made lying flat too uncomfortable. Just until the pain goes away, she told herself. But the pain lingered, and over time, the recliner became her bed. She'd wake up stiff, but managed, until one morning her daughter found her still in the chair, confused and barely able to move her left hand. She hadn't felt a thing, no warning, but a scan revealed she'd had a lacunar stroke, a small, deep stroke caused by a clot that had lodged in one of the tiny vessels inside her brain. She had no major heart condition, no atrial fibrillation. What she did have was poor circulation from years of sleeping upright. Her legs would swell, and her ankles often felt tight. Every morning she'd feel dizzy getting out of that chair. Looking back, the signs were there. But she, like many, never imagined that a recliner could quietly become a stroke trap. Here's the medical truth. Sleeping upright reduces the effectiveness of the baroreflex, your body's natural system for regulating blood pressure. In flat sleep, your brain and heart communicate more easily to balance pressure. But when upright, especially if you're tilted forward or slightly twisted, that reflex weakens, leading to blood pressure instability. In seniors, this becomes genuinely dangerous. Add in medications, dehydration, or compression from tight socks or swelling, and you're facing multiple risk factors at once, all while you think you're just catching a comfortable night's sleep. So, if you're someone who sleeps in a recliner or enjoys naps in that chair, consider this your wake-up call. Sleep is not just about rest, it's about positioning your body to protect your brain. If you absolutely must sleep elevated, use a hospital-style adjustable bed or a firm wedge that elevates your torso without compressing your lower limbs. And be sure to stretch and move your legs regularly to support circulation. Barbara now sleeps in a bed again, with her head slightly raised and a body pillow supporting her hip. She often tells me, "I thought I was making things easier for myself. I never thought I was making them more dangerous." So many people assume the danger is in moving too much, but for seniors, the danger is often in staying still in the wrong position for too long. But if you think a recliner might cut off blood flow, wait until you see what happens when you sleep on your favorite side with your arm pinned under your pillow. It feels natural, comforting, yet it may be the most damaging position of all, especially when you are sleeping on the right side with your arm under the pillow. Millions of people find comfort in this position, particularly older adults. It feels natural, secure. You lie on your right side, tuck a soft pillow under your head, maybe cradle another between your knees, and out of habit, slide your arm underneath. You drift off thinking it's the same way you've slept for decades. But as a brain doctor, I have to tell you that this is often the most dangerous sleeping position I observe in seniors. Not because it causes immediate pain, but because it quietly restricts blood flow to your brain night after night, significantly increasing your risk of stroke during the very hours when you believe you're resting most safely. Let's break down why. When you lie on your right side, especially with your arm wedged under your head or pillow, you're placing direct pressure on major arteries and veins in your neck and shoulder, including the critical carotid artery and subclavian artery. These are vital highways for blood traveling to and from your brain, but when they are compressed for hours, the blood flow slows, blood pools, veins get squeezed, arteries narrow, and in the quiet stillness of sleep, stagnant blood begins to thicken, forming blood clots. That clot might remain in place for hours until you shift in the early morning. Your blood pressure rises with the sunrise, the clot dislodges and travels upward, In mere seconds, your brain is starved of oxygen. Let me tell you about Mr. Ellis Randall, a 75-year-old Vietnam veteran from North Carolina. Strong-willed, fiercely independent, he used to joke that he could still outrun his grandson. Every night, Ellis slept on his right side, just as he had since his military days, curling his arm under his pillow for neck support. One morning, his wife found him halfway out of bed, dazed and unable to move his left leg. He was rushed to the emergency room, where scans revealed a right hemisphere stroke caused by a clot in his middle cerebral artery. But Ellis didn't have high cholesterol, he wasn't diabetic, and he didn't smoke. So where did the clot come from? As we reviewed his habits, it became clear. Chronic pressure on the right side combined with years of sleeping on that arm had compromised his vascular flow. Ultrasound showed a narrowing of the carotid artery. Because he had been unknowingly reducing blood flow for hours every night, a clot formed silently in his sleep and struck just before dawn. Ellis survived, but his mobility is now reduced. He walks with a brace and undergoes weekly therapy to rebuild his coordination. He once said to me quietly, "I had no idea the way I slept could betray me." Here's the scientific truth. This position doesn't just affect arteries, it also compresses the brachial plexus, a crucial bundle of nerves that runs through your shoulder and down your arm. When that bundle is squeezed under your body weight, the nerves don't just go numb. They send distress signals to your brain and can interrupt your sleep cycle without you even realizing it. Over time, this poor circulation and nerve stress can contribute to microvascular damage, the kind that builds quietly until it suddenly breaks. Older adults are particularly vulnerable because with age, blood vessels stiffen and narrow, blood becomes more viscous, recovery from restricted flow takes longer, and nerve resilience decreases. So, if you've been sleeping on your right side, especially with your arm underneath, it's time to make a critical change, not merely for comfort, but because of potential life-altering consequences. Try switching to your left side with your head gently elevated and your arms resting forward or alongside your body, not underneath. Use a contoured pillow to keep your neck in alignment and reduce pressure on key vessels. One small change could protect your independence, your memory, your ability to hug your family, walk your dog, or speak your grandchild's name. You might not feel the damage being done, but your brain remembers, your blood flow records it, and eventually the body reacts. Because what you don't know while you sleep can change everything when you wake up. But if you think sleeping on your arm is risky, just wait until we talk about what happens when your body frequently tosses and turns, indicating poor sleep quality, and how restlessness itself may be a red flag your brain is desperately trying to warn you about before disaster strikes. There's a kind of restlessness that often creeps in as we age, the inability to stay asleep, the frequent waking, the constant shifting from one side to the other. You might simply chalk it up to normal aging, arthritis, or the need to use the bathroom. But what if I told you that this pattern of tossing and turning throughout the night may actually be a significant warning sign from your brain, and even worse, a direct trigger for a stroke? As a neurologist, I've come to understand sleep not just as a way to recharge, but as a critical time when the brain actively restores blood flow, balances pressure, and meticulously clears out toxins. When that vital process is interrupted repeatedly, especially in older adults, the consequences can be quietly devastating. Every time you move sharply in bed, rolling over, shifting your head, or adjusting your neck, you're temporarily altering blood flow to and from the brain. In a healthy 30-year-old, this might not significantly matter, but at 70 or 80, with stiffened arteries, narrowed veins, and fragile vessel walls, each of those movements can create brief periods of reduced circulation. Add in low nighttime hydration, low oxygen levels, or underlying blood pressure issues, and your risk skyrockets. Even more alarming is what we're now beginning to understand. Frequent movement during sleep may not just be a side effect of poor rest. It may be your brain literally gasping for balance. Let me share the story of Mrs. Nancy Delgado, a 76-year-old retired piano teacher from Colorado. She was always sharp, elegant, and precise, the kind of woman who still ironed her pillowcases. But for months, Nancy had been waking up exhausted, despite believing she was sleeping for 7 hours. Her husband mentioned she seemed to fidget constantly in bed, turning side to side every 10 to 15 minutes. At first, they dismissed it as simply aging. Then came the headaches, the early morning dizziness, and one night she woke up with her right hand numb and her words slurred. In the emergency room, imaging revealed she'd suffered a small ischemic stroke, likely hours before she woke. The cause? Her sleep study and vascular scan showed a combination of poor sleep quality and intermittent hypoperfusion, temporary reductions in brain blood flow that occurred during her restless movements. Over time, this unstable circulation led to blood pooling in her neck vessels, eventually forming blood clots. These clots weren't caused by high cholesterol or a heart condition. They were born from interrupted, unstable sleep, the kind that tricks you into thinking you're resting while your brain is actually under siege. Nancy's story is far more common than we realize, and for seniors especially, this kind of fragmented sleep poses several significant threats. It prevents your blood pressure from stabilizing, as normal deep sleep typically lowers blood pressure in a controlled, healing way. It keeps your cortisol levels elevated, which can lead to overnight blood pressure spikes, a key trigger for morning strokes. It disrupts the glymphatic system, which is your brain's natural cleanup crew, leading to long-term vascular inflammation. And it creates constant fluctuations in cerebral perfusion, the critical pressure needed to keep blood flowing through the brain's delicate capillaries. These aren't just medical terms. They are early warning signs, and your body has been whispering them to you through the night. Waking up drenched in sweat, gasping, or feeling your heart race, that's your brain signaling distress. Tingling in your hands, imbalance, or a stiff neck in the morning. These aren't merely age-related nuisances. They may be your body's urgent plea for better sleep positioning, hydration, and circulation. So what can you do? Start by treating your restlessness as a symptom, not just a habit. Avoid late-night caffeine or alcohol. Keep your room cool and dark, but use layered bedding instead of heavy sheets. Use a body pillow to gently cradle your joints and prevent unconscious jerking. And most importantly, talk to your doctor about a sleep study if you or your partner notice you're waking often or moving excessively in bed. Nancy now sleeps with a soft cervical pillow, keeps water near her bedside, and practices slow breathing exercises before bed. Her recovery has been slow, but she tells me, "I used to think waking up tired was normal. I didn't realize it was a warning I was ignoring every night." And she's absolutely right, because when sleep becomes a battlefield, the body truly remembers. But there's another silent threat that works hand in hand with poor sleep, and it often gets overlooked because it starts even before bedtime. It begins the moment you forget or intentionally skip something critical. A dose of medication, a small pill, a simple routine, that might be the only thing standing between you and a life-changing stroke. Let's talk about what happens when you sleep after skipping your blood pressure or heart medication. For many older adults, the routine of taking daily medications becomes second nature until that one night comes when you simply forget. Or perhaps you feel fine and tell yourself, just this once, it won't matter. Maybe the bottle's empty, or you're tired, or you're worried about side effects, and so you skip that little pill meant to control your blood pressure or regulate your heart rhythm. What you may not realize is that one missed dose, especially before sleep, can turn into a silent danger while you rest. For seniors, this danger can manifest as something irreversible, a stroke that arrives before morning without a single warning sign. Let me explain why. Your blood pressure naturally follows a rhythm, rising in the morning and falling at night. This dipping is how the body resets. But if you have high blood pressure, atrial fibrillation, or any other cardiovascular condition, your body doesn't regulate this rhythm effectively on its own. That's precisely what medications are for, to maintain stability when your system cannot. However, when you skip your evening dose, especially if it's a beta blocker, calcium channel blocker, ACE inhibitor, or an anticoagulant, something alarming occurs. Your blood pressure may spike dangerously overnight, often between 2 a.m. and 6 a.m., which are the very hours when most strokes tragically occur. Your heart might race or become irregular, and if your vessels are already narrowed from age, cholesterol, or inflammation, that sudden surge in pressure can cause blood to pool, stagnate, and ultimately form clots that do not stay quiet for long. Consider Mr. Harold Green, a 72-year-old retired electrician from Wisconsin. He was diligent about his health, took walks, ate sensibly, and never smoked. He had mild hypertension, and his doctor prescribed a low-dose medication just once a day at night. One evening, Harold was absorbed in a ball game, got distracted, and simply forgot his pill. He told himself it was no big deal, he'd just take it in the morning, but he never got that chance. The next day, Harold woke up feeling strange. His wife noticed his face looked different, and he tried to speak, but the words wouldn't come. Within an hour, he was in the hospital, suffering a moderate ischemic stroke. Doctors found a small clot in the left hemisphere of his brain, likely formed during the early morning hours when his blood pressure rose unchecked, a direct result of the missed medication. The most tragic part? Harold had no idea the risk was so immediate. He assumed one skipped dose couldn't do much harm, but in older adults, where arteries are less elastic and blood becomes thicker with age, it can indeed be the tipping point. Physiologically, here's what truly happens. Blood pressure medication works by easing the stress on your heart and vessels. When that medication is skipped, this protective shield is gone. Pressure builds, the lining of your arteries becomes irritated, and platelets, the tiny cells that help blood clot, become more active. And where there's pressure and turbulence, a clot is highly likely to form. In seniors, the margin for error is incredibly small. One skipped pill can literally mean the difference between a stable night and a morning that changes your life forever. Harold is now recovering with therapy, but he takes his medication on a strict schedule with no exceptions. He carries a pill reminder in his pocket and told me during a follow-up visit, "One night cost me my words. I won't let it cost me anything else." If you take blood pressure or heart medications, even low-dose aspirin or blood thinners, take them consistently. Set a reminder, ask a loved one to check in, and keep a backup pill organizer beside your bed. Because at this stage in life, your brain relies on routine even more than your memory does. And remember, it's not just what you do that protects you, it's what you fail to do even once that can undo years of effort. But what if the danger doesn't come from inside your body, but from the very room around you? From the cold air brushing across your neck while you sleep? From the missing support beneath your head? What happens when you sleep in cold rooms without proper neck support? You might be surprised how quickly it can negatively affect your brain, and it has absolutely nothing to do with comfort. We often associate cool nights with better sleep, that crisp air, the cool sheets, the way your body curls into warmth beneath a blanket feels so refreshing. Many older adults even turn the thermostat down low, believing it's healthier or more energy efficient. But what if that cold room, especially when combined with poor neck support, was doing more than just making you shiver? What if it was quietly restricting blood flow to your brain, tightening your arteries, and significantly increasing your risk of a stroke while you sleep? Most seniors don't realize this, but temperature and posture during sleep deeply affect your vascular system. As we age, our body becomes less efficient at regulating heat, particularly at night. A cold environment causes vasoconstriction, the narrowing of blood vessels. This effect is most dangerous when it occurs in the neck, where two vital arteries, the carotid and vertebral arteries, supply oxygen-rich blood to your brain. Now imagine your neck slightly bent at the wrong angle on a soft pillow, or worse, completely unsupported. That subtle misalignment, combined with cold-induced vasoconstriction, dramatically reduces the flow of blood to the brain. In an aging body, where vessels are already stiffened and blood circulates slower, this creates a deadly combination: restricted flow, pooling blood, and the inevitable formation of clots. Let me tell you about Miss Loretta Dixon, a 78-year-old retired nurse from Montana. She was as sharp as ever, full of captivating stories and wit. She had always preferred a cool bedroom and slept with the window cracked, even in the depths of winter. Her habit was to curl up tightly, her neck slightly tucked into her chest, with only a flat pillow beneath her head. She believed this was normal, even healthy. Then one morning, she didn't wake up as usual. Her son found her partially alert, but unable to focus her eyes. Her speech was slurred, and she couldn't sit up on her own. At the hospital, scans showed a brainstem stroke, a particularly dangerous type caused by a clot in the posterior circulation. The area fed by the vertebral arteries, which run along the spine and through the neck. There was no heart disease, no history of smoking, no skipped medication. But there was one likely culprit: chronic neck compression and cold-induced vasospasm while sleeping. Over time, These two factors had reduced blood flow just enough to form a clot, which then traveled into the most vulnerable part of her brain. Loretta is now in physical therapy. She walks with assistance and has difficulty swallowing, a painful reminder that what we often overlook as minor discomfort can change our lives in a single devastating night. Cold temperatures tighten vessels, and poor neck support misaligns those vessels. Together, they quietly reduce oxygen to the brain, especially in the early morning hours when blood pressure naturally spikes. If your brain is under-oxygenated and your vessels are constricted, even a small clot can cause devastating damage. Here's something else most people don't realize. Many seniors already have some degree of cervical spondylosis, age-related changes in the neck spine. When you combine this with poor pillow support in a cold room, the risk of reduced blood flow to the brain increases dramatically. So what should you do? Keep your room cool, but not cold. The optimal sleep temperature for older adults is around 65 to 68 degrees Fahrenheit, 18 to 20 degrees Celsius. Make sure your neck is properly supported. Use a medium firm pillow that keeps your head aligned with your spine, not angled downward or turned sharply to one side. Avoid sleeping with your chin tucked into your chest or your head cocked to the side. These small adjustments may seem insignificant, but they are acts of profound protection, a way of keeping your brain nourished and safe while you sleep. Loretta told me recently, "I never thought something so simple, the cold, my pillow, could hurt my brain. I just didn't know." And that's the most frightening part. So many seniors don't know. They're doing what feels natural, what they've done for years, without realizing that the aging body plays by vastly different rules. But sometimes the danger isn't in the position you sleep in, it's in what you did just before you closed your eyes. Because the final habit may be the most misunderstood. What happens when you go to bed right after a heavy meal or a glass too many? What does alcohol or late-night digestion do to your heart, your blood pressure, and your brain while you rest? Let me take you there, because this last one could be the hidden trigger that pushes everything over the edge, sleeping immediately after heavy drinking or a big meal. There's a common belief many of us carry into our later years that a full belly and a glass of wine help us sleep better. That feeling of warmth, comfort, and winding down the day with a hearty dinner and a nightcap is a cherished ritual in many households. But as a neurologist, I need to tell you something you may never have heard before. Going to bed right after a heavy meal or alcohol may silently trigger the kind of stroke that robs you of everything, your speech, your memory, your independence, before you even know it happened. The aging body processes food, alcohol, and stress very differently than it once did. What once brought comfort can now become a silent danger. When you consume a large, fatty meal late at night, especially one rich in sodium or sugar, your digestive system works overtime. Blood is redirected from the brain to the gut to aid this digestion. This temporary drop in brain circulation may not feel dramatic, but if your arteries are already narrowed with age, the consequences can be significant. Add alcohol to the equation, and you've just created a perfect storm. Alcohol acts as a vasodilator first, widening blood vessels. That's why your face might flush or you feel drowsy after a drink. But as it wears off, your vessels suddenly constrict again. Blood pressure surges. The heart works harder to stabilize itself. In older adults, this abrupt shift can lead to arrhythmias, sharp blood pressure swings, and poor oxygen delivery to the brain, all of which quietly raise your stroke risk, especially during sleep when you're most vulnerable. Let me tell you about Mr. Gerald Thompson, a 74-year-old retired farmer from Nebraska, a man of discipline and strength. Gerald had one simple joy: his evening routine, dinner at 7, a glass of bourbon at 8, bed by 8:30. One winter night, he indulged in a holiday dinner: turkey, mashed potatoes, gravy, pie, and his usual drink. He felt satisfied, even proud. But that night, something changed. Around 4 a.m., his wife awoke to find him cold and unresponsive. He was rushed to the emergency room where a CT scan revealed a massive ischemic stroke in the frontal lobe, caused by a clot that had formed and traveled during the night. The doctors found no signs of atrial fibrillation, no recent infection, no skipped medication. What they did find was elevated post-meal triglyceride levels, dehydrated blood, and constricted vessels from alcohol rebound. That combination had reduced circulation to the brain just long enough to allow a clot to form quietly and fatally. Gerald survived, but the stroke stole his ability to speak. His wife, now his full-time caregiver, told me through tears, "We thought we were doing everything right. We didn't know dinner and a drink could take him from me." The truth is, digestion and alcohol compete with your brain for resources. After age 60, the digestive system slows down, meaning food sits in the stomach longer, drawing blood away from the brain for hours. Alcohol further dehydrates the blood and can disrupt the natural heart rhythm. Combined, these two forces create unstable blood pressure, encourage clot formation, and reduce cerebral perfusion, especially during the early morning surge in cortisol when strokes most often occur. If you are going to drink, do so in moderation, ideally earlier in the day. If you enjoy a full meal, allow at least 2 to 3 hours before lying down. Drink water with your dinner. Avoid salty, greasy, or sugary foods late at night. And don't mistake drowsiness for healthy sleep. Alcohol-induced sleep is fragmented and disruptive to brain function. This isn't about never enjoying food or a drink again. It's about respecting what your body needs at this stage of life. You've worked hard to live well. Don't let a simple dinner routine undo what you've built. Because when it comes to stroke, the threat doesn't always come with pain or warning. Sometimes it comes quietly, wrapped in comfort, disguised as routine. Now that we've uncovered the 9 most dangerous sleeping habits that could raise your risk of stroke overnight, you may be wondering, what does safe sleep really look like? What can I change, starting tonight, not just to sleep better, but to protect my brain for the long run? Let's bring it all together. I'll walk you through the habits that heal, not harm, because prevention begins with awareness, and the power to change begins with you. This is your final wake-up call. Sleep isn't just rest, it's protection. If you've made it this far, I want to sincerely thank you, not just for watching, but for caring enough to truly understand the truth about how sleep can quietly shape the health of your brain. What you've just learned isn't about fear, it's about power, the kind of power that comes from awareness, from knowing what's happening inside your body while the world sleeps. At this stage in life, knowledge is not merely helpful, it is profoundly protective. And every choice you make now, no matter how small, carries more weight than it did decades ago. We've explored 9 silent habits that may seem harmless, positions of comfort, routines of familiarity, decisions made out of pain or fatigue, but each one has the potential to slowly, quietly push the brain toward danger. Sleeping flat without a pillow, face down in a recliner, under a heavy blanket or on your favorite arm, tossing and turning all night, skipping your medication, sleeping in the cold without neck support, or going to bed with a full belly and a glass of alcohol. Each of these over time creates the perfect conditions for blood to stagnate, thicken, and clot. And in a body already facing the natural changes of age, stiffened arteries, slower circulation, less oxygen, these clots are not just possible, they are far more likely. But here's the most important truth I can offer you as a doctor. Most strokes that happen during sleep are preventable. Let that powerful statement truly settle in. They are not inevitable. They are not random. They are often the direct result of routines we never questioned, signals from the body we perhaps ignored, or comfort habits that no longer serve us as we age. So, if there is one message I desperately hope you carry from this video, it's this: you still have control. You still possess the ability to change how you sleep, how you care for your brain, and how you protect your tomorrow. Because sleep is not just rest. Sleep is when the brain actively restores blood flow, meticulously clears toxins, balances hormones, and prepares itself for another day. Sleep is when your brain is most vulnerable, but also when it is most open to healing, if you simply let it. Start tonight. Elevate your head slightly. Sleep on your left side if you can manage it. Support your neck properly. Skip the late drinks and heavy meals. Take your medications without fail, making them a non-negotiable part of your routine. Choose breathable bedding. Hydrate consistently. Create a sleep space that honors the years you've lived and the vibrant life you still want to enjoy. These are not dramatic changes. They are subtle shifts, yet they carry immense weight. In a world full of things we can't control, this is one critical part of your health where your decisions matter every single night. You're not too old to change, you are not too far along to protect yourself, and you are never too late to learn how to sleep, not just for comfort, but for survival. As I often tell my patients, it's not about how long you sleep, it's about how wisely you sleep. So tonight, as you pull back the covers and lay your head down, ask yourself, is the way I'm sleeping helping my brain or hurting it? Because when you protect your sleep, you protect everything. Your speech, your memory, your balance, your independence. You protect the very essence of who you are, and that is always, always worth it. These insights are meant to inspire you to live fully and authentically. If you found this video helpful, please consider leaving a comment to let us know. Your feedback helps us create more valuable content for you. Don't forget to like, share, and subscribe to our YouTube channel for more essential health tips like these. Thank you for watching, and here's to living life on your own terms.